Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for British Columbia for Monday, January the 25th. We're honored to be here on the territories of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. Tomorrow, Tuesday, and Wednesday, we'll be providing written briefings at 3 o'clock with up-to-date information on COVID-19 cases and outbreaks in British Columbia. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you and good afternoon. So today being Monday, we're reporting on 3 periods from January 22nd to 23rd. We had 527 new cases of COVID-19 diagnosed in British Columbia. From the 23rd to 24th, an additional 471 new cases, and in the last 24 hours, 346 new cases. That brings us to 1,344 new cases diagnosed with COVID-19 in British Columbia this weekend, 3 of whom were epidemiologically linked, bringing our total number of people diagnosed with COVID-19 to 64,828 in British Columbia. Of the new cases, 314 people were in the Vancouver Coastal Health Region, 618 people were in the Fraser Health Region, 73 people were in Vancouver Island Health, 234 people were in the Interior Health Region, 104 people were in the Northern Health Region, and 1 person was a case who normally resides outside of Canada. We now have 4,392 active cases across the province, of whom 328 are in hospital, 68 of whom are in critical care or ICU. We have over 6,607 people under public health monitoring because of exposures to COVID-19, and 57,831 people are considered recovered. Again, this weekend, we have had new deaths from COVID-19. 26 people have died this past weekend. Our seniors, our elders, our family members, our community members, and our hearts and thoughts go out to all who have lost people this weekend. This is a very challenging time. Continuing to be a challenging time to lose somebody, especially from COVID-19, and our thoughts are with you. We've had 1 additional healthcare outbreak at the Nanaimo Regional General Hospital, one ward at that hospital. And on a very positive note, we now have 11 outbreaks that have been declared over. At the Avalon Gardens, the Braddon Private Hospital, the Fraserview Intermediate Care Lodge, the Good Samaritan Delta View Care Lodge, the Menno Home, one of the larger of our outbreaks, Peace Arch Hospital Foundation Lodge, Sunrise of Vancouver, the Harrison at Elam Village, Waterford Retirement Residence, Williams Lake Seniors Village, and the UHNBC Rehab Unit outbreak have all now been declared over. And this brings a moment of happiness to us all and relief for many of the care providers and the families with loved ones in these facilities. And I think it is a reflection as well of how important the immunization program that we've had in long-term care over these last few weeks and the difference that it's going to make and continues to make. We now have 29 active outbreaks in long-term care and assisted living and 9 acute care units. These involve 1,009 residents and 579 staff. Currently, we have 1 new outbreak in the community at the Surrey Emergency Response Centre and in the Fraser Health Region. On Friday, along with Premier Horgan, Minister Dix, and Dr. Ballum, we shared the details of our province-wide COVID-19 immunization plan and our age-based approach that will follow on from the phase 1 that we are in currently. Everyone in BC is important, and everyone who is eligible will have access to the vaccine as soon as we have vaccine available. What we know is that no matter where you work or what you do, age is the predominant risk factor for having severe illness or dying from COVID-19. And the approach that we are taking ensures that those who are at highest risk of illness and death receive the vaccines first. This weekend, unfortunately, we received additional information about holdups to the supply of the Pfizer vaccine that we were expecting to receive in the next few weeks. This next 2 weeks, we're going to have very little vaccine. As we knew, we are receiving no Pfizer vaccine this week, and it is also a week where we do not receive any new vaccines from Moderna. We have to manage our supply within the limited amounts that we have. And on this weekend, we found out as well that the amounts that we were expecting to receive in the first week of February have been dramatically reduced. And we right now do not know how much, if any, vaccine we'll be receiving the following 2 weeks in February. We know that the federal government is doing everything in their power to make sure that our vaccine supply gets back on track as soon as possible. But within what we have right now and what we know is coming into the province, we need to make some changes to the phase 1 that we are in at the moment. Because of this extremely limited supply over the next 2 weeks, we have made the decision that we will be delaying second doses up until day 42 for these short period of time. This means we can use what little supply we have right now to finish our long-term care home immunizations and to address the outbreaks that are happening in our hospitals and our communities. We know that addressing these, in particular, the most vulnerable people in our communities and in our acute care system, will protect all of us going forward. This is about putting out fires before they get out of control. It's about choosing in the short term to give more people this protection from dose 1 instead of giving some people full protection and leaving others with none. We will make up these doses, and we will be providing the second dose of vaccine to everybody as soon as we possibly can. In the past week, we have delivered 119,850 doses of vaccine. That's 87,788 doses of the Pfizer vaccine and 32,062 doses of the Moderna vaccine in British Columbia. That's of the 144,500 doses we have received as of today. And it also includes 3,193 second doses for some people who got it at the beginning. I think importantly, though, we have, as you know, been focused on long-term care and assisted living, where we know the risk is highest and the impact is greatest. And as of today, I'm very pleased to say that we have immunized 33,023 long-term care facility staff, 25,701 long-term care residents, and a number of them, several thousand, close to 3,000, have received as well dose 2. In addition, we've immunized 4,050 staff who work in assisted living and 7,147 residents in assisted living. What this tells us is that over 60% of the vaccine that we have to date has gone to protecting those who are the most vulnerable in long-term care and assisted living. And that I'm very grateful for, and my hat goes off to all of those who have been running the immunization programs to protect those most vulnerable. That includes all of the long-term care and assisted living facilities in the Island Health Region, Vancouver Coastal and Fraser Health, and we will have all of the long-term care and assisted living facilities in Northern Health and Interior Health completed by the end of Wednesday of this week. That is an amazing feat. In order for a vaccine to be approved for use in Canada, as we know, it must go through extensive safety reviews. But it's also incredibly important with new vaccines, especially new platforms like the ones that we have that are working incredibly well, that we monitor very carefully for safety. And so today I wanted to report as well on the safety signals that we've been following in British Columbia and reporting nationally what we call adverse events following immunization, or AFEs. And there is a very strict criteria that we use for monitoring these, and the reports come into the BC CDC. We have a committee that looks at the serious reports and looks at their association and whether they're caused by vaccine or not. We know that when we're immunizing people who are elderly and who have underlying health conditions, that there are other things that will happen when we're doing immunization programs in large numbers of people. So it's very important for us to know exactly what vaccine people got when, down to the lot number. So far in BC, we've had 56 reports of adverse events following immunization in the close to 120,000 doses of vaccine that's been given. We've had 10 reports of anaphylaxis, or serious reaction to the vaccine. That's about 8 per 100,000. That is slightly more than we would expect based on other immunization programs, such as for influenza, for example. We had 1 hospitalization out of those 10 people who had anaphylaxis, but all have recovered. In addition, we've had 16 other allergic reactions that were associated with the vaccine, and 1 case of what we call Bell's palsy, or paralysis of part of the face. That's something that we've seen reported in the trials for this vaccine as well. So this is important for us to continue to follow. So far, there has been no associated deaths from immunization, and we are monitoring all of these safety signals very carefully. As part of our provincial monitoring as well, we've been paying careful attention, as you know, to children with COVID-19 symptoms, and we have a surveillance system for multisystem inflammatory syndrome in children, or MISC. And to date, as I reported last week, we have had 6 children in BC who have been diagnosed with MISC. So that is children who have had the symptoms that are associated with this inflammatory condition and have had a positive laboratory test or exposure to COVID-19. So we have 6 confirmed cases. They were 3 female and 3 male. They ranged in age from 1 to 15 years of age, and all of them are either recovered fully or recovering. In addition, we monitor all people who might have symptoms that could be associated with MISC, and this is something that we've seen for many years, a syndrome called Kawasaki Syndrome. It's very similar to that. And so we've had 19 additional children between the ages of 0 and 17 who have had an investigation, and none of them have turned out to be associated with COVID-19. Finally, I've been reporting weekly on a number of issues that we see, these both around immunization and also around the surveillance that we're doing for variants or new strains of COVID-19, what we're calling in Canada and around the world variants of concern. As we saw from the start of the pandemic, we can use things like whole genome sequencing to help us understand how the virus is traveling across the country and through the province and around the world. There are now a number of variants circulating worldwide that are proving to transmit more easily than the ones we've seen in the past. In particular, we're concerned about one that has been labeled the UK variant, but it is technically known as B117, and we have had 5 cases of the B117 variant detected here in British Columbia. All of them are either related to travel or related to close contact with a traveler, including the 3 initial cases. So far, we have had no ongoing transmission from any of the 5 identified UK cases. In addition, we've also had 3 cases arise through our surveillance of the B1351 variant, and this is the one that has been linked with increased transmissibility in South Africa. All 3 of these cases were community acquired, so they were not linked to travel, which is of course something we are concerned about. They weren't linked to each other, and we're now investigating. 2 were in Vancouver Coastal, 1 in the Fraser Health region, and Public Health is doing backward contact tracing, trying to determine where they may have acquired their infections. These are, of course, concerning because we know that if we start to see rapid transmission, that we could be in a position where we're having way more transmission in our communities than what we're having now. We have been following using whole genome sequencing through the BC CDC from the very beginning, and we've sequenced about 11,000 samples so far. And we continue to monitor in areas where we are seeing ongoing transmission, where we're seeing rapid transmission, and where we're seeing transmission in, for example, younger people, to determine if these variants could be associated with disease here in British Columbia. So far, we have not seen widespread transmission, but it remains a concern and something we'll be watching carefully. But we also need to know that the things that we do to prevent transmission of COVID works for these variants as well. There are several things that I need to speak to you about this today. First, and most important, is to make a very specific request of everybody in British Columbia. In the last couple of weeks, we have plateaued at about 500 new cases of COVID-19 a day. This is too many. This leaves us at a precipice, at a brink, where we can see rapid takeoff, particularly if we start to see any of these new variants starting to transmit in our community. This shows us that while we're getting a handle on long-term care, the virus continues to circulate in our communities. And our immunization is working in these high-risk settings, but we are still at risk. We're at the threshold of where we were in late October, November, when cases started rapidly escalating. And we need and know how to stop this. We can either go up, and where we've seen that happen in other provinces, in other countries all around us, we will have more people severely ill. When we have lots of people infected, even young people become severely ill, end up in hospital. We will have more of our family, our community, who are hospitalized, who need ICU care, and who will die from this virus. We will have more of our healthcare workers under strain, and more restrictions will be needed to slow things down in our community. Or we can have less. We are now into the second incubation period from our winter break. Less is where we need to go, and I need your help to get there. Over the next 2 weeks, I believe we can bend our curve, not just plateau, but bend it back down. And this is at a time that's critical, where we have very limited vaccine, and we need to target it where it will do the most good. The public health restrictions in our province are dependent on what we all do now. My ask of you is to take a step back and remember that COVID-19 is still that unwelcome guest in our homes, in our workplaces, in our communities. I'm asking you now, as much as possible, more than you've ever done before, to stay home, to stop those social interactions, to focus on the key things that are keeping us together, focusing on our work from home if we can, focusing on making sure children can go to school. focusing on making sure our healthcare system can continue to function. This is the most challenging of times for us. It's not the time to falter, despite us being tired and frustrated and wanting it to be over. We need to hang in there. We are so close, but we need to do this now. We need also to remember to find joy every day, to find those things that get us through this. We've been in this for a year now. We know there are things that we can do to support each other. We know how important it is to go outside every day, to get a little bit of fresh air and perspective, to make sure that we find that moment where we can listen to music, where we can look at art, where we can find theater online, those things that give us that joy in life. To make sure we hug each other, that we take care of our family that we're close to in our households, and that we reach out virtually and care for those who are around us in our community. Right now, we can't rely on the vaccine to protect us all, yet. It's our individual efforts now more than ever that will have the impact that we need right now in these next 2 weeks, so that we can get back to having those social interactions we all want and need. For the next 2 weeks, I am asking you to do more. Take a step back, stay home, stay away from others, join in our effort to bend our curve. We need to share these messages with all of us. It is our time again that we need to make this work. With your help, I believe we can get there. Across our province, today, tomorrow, we can make a difference. And we need to do that as we have been, by remembering to be kind, to be calm, and to be safe.
Thank you very much, Dr. Henry, and I wanted to start by passing on my condolences, those of the Premier, really of everyone in BC, to the families, the friends, and the caregivers of the 26 people who passed away over the past 3 days from COVID-19 in British Columbia. It is, as Dr. Henry has said, a very, very difficult time to grieve, and to lose a loved one in this time is, I think, an especially difficult thing. Our hearts are with all these families, with all these friends, with all these people who have worked and in many cases worked hard to try and help people get better and to support them in their most difficult moments, and we think of them today. I wanted to note in the acute care sector, where we've had at least one very significant outbreak in the last few days, the most significant outbreak being at Royal Inland Hospital in Kamloops, that overall we're still doing, in terms of acute care capacity across the board in British Columbia, we're doing fine. Our current level of occupancy in acute care, which is normally at or around 100%, is at 88.7% right now of base beds, and 72% of base plus the surge beds that have been added during the pandemic. That our occupancy level in critical care is at 72.2%, or 49.1% of all beds when you add, again, the surge beds. That said, the Royal Inland outbreak is a significant one. There are 46 cases at Royal Inland, 17 among patients, 29 among staff, and all efforts are being made both to support Royal Inland in terms of infection control, and also to provide additional supports with respect to immunization. But we're thinking of those folks today and thanking them for their efforts in these really, really difficult times. I think there is some positive news here today as well with respect to long-term care. If you look back to January 15th, just 10 days ago, there were 49 outbreaks in long-term care, assisted living, and independent living, and today 10 days later, on the 25th, there are 29 such outbreaks, which is obviously a reduction of 20. That's 42 outbreaks in long-term care to 26, 5 in assisted living on the 15th to 3, and the 2 outbreaks in independent living have been declared over. So these are significant and positive steps. I can tell you personally, as a family member, but also just from the many people in long-term care I talk to on a regular basis, that the day outbreaks are declared is an extraordinarily difficult day. If you're living in a care home or a resident, if you're a staff person in a care home, or if you're a family member, the day they're declared over, in contrast, can be a very positive day. And for, as we've reported today, in a significant number of care homes, that happened today or has happened in the last 10 days. And this reflects the extraordinary effort being made, and it has been made, to immunize people living in long-term care, residents in long-term care, and staff in long-term care. As Dr. Henry has noted, about 60% of the vaccine has gone for this express purpose. Just to note that not all long-term care or assisted living residents are eligible for vaccination. Examples of issues that impact eligibility includes issues of consent, recency of the COVID-19 diagnosis, or other health issues. Nonetheless, we've seen across the piece relatively little in the way of what's sometimes called vaccine hesitancy in this sector. Detailed vaccination coverage rates by facility once we've finished, and all care homes in BC will be finished this week, and in 3 health authorities, including Fraser Health, Vancouver Coastal Health, and Island Health. They've already been completed in their entirety. The detailed vaccination coverage rates will be made available by February the 8th and be posted at the BC CDC website. I wanted to note with respect to long-term care that in late spring, the Ministry of Health commissioned a progress review of the response efforts made and action taken by the Ministry and health authorities in the first wave to protect residents of long-term care from COVID-19. The Ministry would normally undertake this kind of assessment itself, reaching out to stakeholders. But due to their work on the pandemic, Ernst & Young, a pre-qualified supplier of such services, was asked to assist to conduct the interview, review background material, and put together high-level recommendations on areas for potential improvements suggested by the sector. Through the progress review, Ernst & Young conducted one-on-one or small group interviews with more than 40 stakeholders, including the Ministry of Health, health authorities, the BC CDC, seniors associations, care home operators, providers, frontline staff, and unions. The objective was to seek input from a number of people across the sector about the progress so far in keeping residents of long-term care safe, and where and how any improvement in the progress could be made, both in the shorter and longer term. There is also a commitment to share the final report with the sector and take action on the high-level recommendations brought forward. The report arrived in late October for the Ministry's considerations, and the contents of the report were immediately acted upon by the Ministry, and a summary of those actions has been made available along with the report. While other areas identified in the report where progress could be further broadened or expanded, or had not been identified internally, were also targeted for action. The Ernst & Young Progress Review organized observations and recommendations into 4 focus areas: governance and decision-making, policy, operations, and workforce. Within each area, strengths were identified, as well as opportunities for addressing perceived gaps. Ernst & Young made 14 short-term and 5 long-term recommendations for consideration by the Ministry related to the observations. The background document, as they say, issued with the release of this report, summarizes the observations and provides an overview of related Ministry actions. All of that said, I want to express my appreciation to everyone involved, including Ministry staff. The report should have been released earlier. It was available at the end of October. It was only brought to my attention 10 days ago, I think, and I would say this in context. It should have been released earlier. I take responsibility for that. I'm the Minister of Health. I think that the people working in the area, working in our health services branch, are working their guts out, are consumed by helping people in long-term care, as I am, have been working hard on the file. And I think it's because of that they did not proceed to ensure that the report was made public, which is the appropriate thing to do in these circumstances, and also the courteous thing to do when you've asked stakeholders to contribute their opinions to a report, to share the report with them. And for that, I apologize. In terms of frustrations people may feel about that, I would just put it in context that I think when you read the report, you'll see that action has been taken on it. And when you read the report, you'll see that overall and on balance, the outcomes in British Columbia have been positive, or were positive, especially at the time the report was done. It's been more challenging since. And so I just wanted to say that, people should have ensured that the report was released. Those same people have been working their guts out, and I ask people to show the same compassion I feel towards people who are giving everything they have to help people across British Columbia. In closing, what we know is that COVID-19 is everywhere in BC. The vaccine is encouraging, of course. It's encouraging in long-term care. It's encouraging across the province. But we cannot let it distract us from our duty. Let's be clear. Everywhere in BC, we must stop the spread. This is a crucial moment in the pandemic. These next weeks are crucial, as Dr. Henry has said. COVID-19 looks for easy opportunities to spread. The hands unwashed, the mask unworn, the physical distance ignored, the non-essential travel taken, the risk discounted. It thrives on public health orders and guidance disobeyed, unheeded, and our skills unused. In the weeks and months ahead, we must continue to heed and adapt to our BC pandemic reality. There can be no welcome mat for COVID-19, no porch light on to draw it to our door, no opportunity for it to cross that threshold. We've been taught the skills to stop the spread. We must use them. We must only socialize with the people in our household. We've been given the guidance to keep us safe, and this is the moment to follow it. And we've been provided with the public health orders that save lives. We must uphold them everywhere in BC. We've been 100% committed to our fight, but our fight is far from over. We must dig in to stay all in on our duty to stop the spread in our homes, in our communities, everywhere in BC, for the ones we love and for the ones we don't know. Aujourd'hui, nous faisons le point sur le nombre de nouveaux cas pour 3 périodes de référence de 24 heures chacune, soit celle du 22 et 23 janvier, celle du 23 et 24 janvier et celle du 24 jusqu'au 25 janvier en mi-journée. Il y a eu 27 nouveaux décès liés au COVID-19 durant ces 3 périodes de référence. Nous offrons nos condoléances aux familles et aux amis des 1155 personnes décédées du COVID-19 et à tous ceux qui ont perdu des êtres chers au cours de cette pandémie. Pendant la première période de référence, nous avons eu 527 nouveaux cas. Pour la deuxième période de référence, nous avons eu 471 nouveaux cas. Au cours des dernières 24 heures, 346 nouveaux cas se sont ajoutés. Parmi l'ensemble des cas confirmés de COVID-19, 328 personnes sont actuellement hospitalisées, dont 58 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. As a reminder to everybody on the phone, please press *1 to enter the queue. You will be limited to 1 question and 1 follow-up only. I would also ask that you please take your phones off mute. You are not audible until your name is called. First question today is from Marcella Bernardo, News 1130.
Hi, everyone. I have a lot of questions, but I know I'm limited to 2, so I'm going to start with this report from Ernst & Young that came out in the fall and identified problems that needed to be fixed. And during phase 1, outcomes were better. So can someone please explain what went wrong in November when supposedly changes were being made to ensure that long-term care was going to be better in the fall than it was in the spring?
I'll start by saying, we are learning as we go. And we know, of course, that this virus is transmitted through people. And it is very challenging for us to know when people are incubating the disease and when they can transmit it to others. As we have had more transmission in our communities, that's reflected in outbreaks in long-term care. That's the single most important factor, and we've seen that around the world. So there are many things that were done and many things that still need to be done. there were some of the issues that were identified that are not things that are going to be solved within a matter of months or weeks. They are longer-term issues that we are still dealing with and still struggling with. And yes, it is very much a challenge. When we started to see dramatic increases in the community, that was reflected in outbreaks in long-term care. And tragically, that has meant that we have lost more of our seniors and elders. And that has been the overriding reason why our focus of immunization to start with is in those settings.
I think that's right. I think one of the things that we've noted and is noted in the report is that British Columbia has, and over the time of the pandemic, done better than other jurisdictions. But if you have a family member in long-term care, what happens in Ontario or Quebec or Alberta or Manitoba is of little relevance to you. I think actions have been taken to make significant improvements. But what's happened in November and December and now January in this second wave of COVID-19 is significantly more community transmission, and that reflects in long-term care. On Vancouver Island, we've had very few, I think less than a handful of people who've passed away in long-term care in all the care homes on Vancouver Island, which are putting in place the same measures, but there's significantly less community spread, and that affects healthcare workers less, and there's less outbreaks. So I think this has been true everywhere in the world, and every effort that we can make in long-term care, we're making. I know from throughout the pandemic, from having talked to families, from having talked to care workers on a regular basis, what it means. Because in addition to the cost, the people who've lost their lives and the impact of the outbreak on residents, on families and staff, we're coming up to March and a year, the first year after restrictions on visitations were put in place in long-term care, and some of those were lessened on June 28th of last year, but they're still in place, and so the consequences for people are significant. We're aware of that, and that's why those measures on visitation, the measures on single site, the measures on bringing PPE, bringing long-term care homes, which are generally responsible for their own PPE under their contracts in the contracted sector, into our supply chain. All of the efforts in infection control, the efforts in many care homes that have had outbreaks for health authority officials to go in and lead or help with the leadership of those care homes and the challenges they face. All of those things have occurred, and yet you're absolutely right. There have been significantly more outbreaks and more losses, and we continue to take those actions, and we'll continue to take the actions. And one thing I want to emphasize finally, everywhere, is that while immunization is an important answer, people have to continue to dig in the healthcare sector, in every other sector, and in the community, that even when one is immunized, one has to continue to use PPE and to use protections and to support social distancing. This is a time, January, when there is spread of COVID-19 everywhere in the world and here in British Columbia, with the cases that we announced today, almost 500 a day, just slightly below. And we have to continue to take steps to reduce that transmission in order that those most vulnerable are kept safe.
Do you have a follow-up, Marcella?
I do. It's regarding the rollout of the vaccine from last week. I know when initially we started receiving doses from Pfizer and Moderna, Dr. Henry expressed concern about the safety of those stocks. And with the rollout now moving to 172 communities, what efforts are going to be made to ensure that we don't have terrorist attacks or sabotage of that much needed vaccine?
Yeah, that's one of the things that we've been thinking about, and it is one of the things that we have been working closely with the NOC, the National Operations Center, and we do have federal agencies that are involved in helping assess the risk as it goes. We also have procedures in place around how the vaccine is transported and safety measures. And as we've had more vaccine available, it's been easier and more ability to be more open about where the clinics are. We do have security, of course, and we will continue to have that to make sure that people are comfortable and safe in those clinics. So far, we have had really good response, and we have not had any incidents that we're aware of, but we have been watching that very carefully. I know there was a lot of online chatter, we understand, from the security services about disrupting the vaccine supply chain and undermining confidence in the vaccine for various reasons. A lot of that came out of issues in the United States and other places. So it seems to have settled, which is a good thing. Obviously, right now, our biggest concern is access to vaccines so that we can get this program up and running.
Next question is from Victor Kaiser, Radio NL.
Good afternoon, Dr. Henry. Just was trying to hope to get some more information on the outbreak at Royal Inland Hospital. We've heard concerns after it grew from 8 to 48 cases, the lack of information, lots of rumors and anxiety over the weekend. Heard that health authorities perhaps don't have all of the resources they might need to put out information in a timely manner, whether it's the interior or the lower mainland or elsewhere. So I was hoping whatever you could tell us about the outbreak, but then also these issues of this perceived lack of transparency.
Yeah, I think it is always a challenge about who wants what information, and the focus, the overriding focus, has been on providing the information to those who need it in the facility, the patients and their families, the staff and the staff in the facility. So that has been and will continue to be the overriding issue that people are paying attention to. And yes, the outbreak did grow. We've seen this with many outbreaks, that we tend to have 1 or 2 cases identified, and part of our automatic response to outbreaks, particularly in care homes and in acute care facilities, is doing testing of all of those staff and patients or residents in the affected area. And so we expect, and what we have seen is, as we do more testing and we do surveys of all of the people who are potentially exposed, the numbers of people who test positive go up. So it is part of the routine outbreak response. We know that this part of Interior Health has not had a large outbreak in their healthcare facility, but yes, they have been accessing resources from Interior Health, from the Lower Mainland. We have a support process both for public health, for infection control, to support staff in the area as well. So I know the investigation, and very often early on, the numbers are changing very quickly. So that is another factor with it, and the investigation was ongoing since the first cases were detected late last week. It is always trying to satisfy that need for everybody to know exactly what's going on as things are changing very rapidly, and they do change very rapidly, especially early on. So we did have the numbers today. Those will change, and they'll change as this outbreak progresses. And the outbreak control measures are put in place, and Interior Health is continuing the investigation there.
Follow-up, Victor?
Yes, Dr. Henry, I know we also heard from some patients at the hospital here saying some of the nurses they came in contact with when they went in for other procedures in December weren't necessarily wearing masks, and I guess these patients perhaps eventually contracted COVID by being in a different ward of the hospital. They allege the masks were really, they allege rather that even they weren't required to wear masks, only had to when being taken to get more tests. So I'm not sure if you're able to kind of address maybe concerns like this, that protocols perhaps may not be following strictly by health officials or even patients, And now, as you mentioned, we have this first significant outbreak in the Kamloops area.
Yeah, you know, I think there's lots of things in every outbreak that we all second guess and go back and think, well, maybe we should have done this or that, or this was the cause of it, or that was the cause of it. It's always a number of factors, and I can't obviously be in every facility in every outbreak, but those are the things that we look at. And yes, this is a wake-up call. It's a warning to everybody that we cannot let our guard down, and we need to be following the protocols. We have provincial protocols about when masks should be worn, how they should be worn, what should be done for infection prevention and control in this time of pandemic in every healthcare facility, in every long-term care home. But we also know that people are human, and that it is always impossible to always adhere to everything that we need to do. That's why we have what we call layers of protection, or a hierarchy of controls in acute care facilities. And that includes things like having barriers. It includes things like administrative policies that say you have to be screened actively before you come in every day. We know that people get tired with that, and sometimes things slip. We know that there's a testing policy. We know that things like we minimize the number of people in the room. We set up the waiting areas so that there aren't people right next to each other, that masks are available, that hand hygiene is available. There are layers of protection in the hierarchy of controls so that we don't only rely on one thing like mask wearing. But these things get stretched, and this virus shows us again and again that even small breaches can lead to transmission when we're not expecting it. And it's often not where we are paying attention when we're providing care to a patient, for example. It may be when we're inadvertently letting things slip, when we're in the lunchroom with the people we work with every day, or when we're in a setting that we think is less risky. So all of those things are the things that we pay attention to once we start detecting cases, once we see how far it's spread, and we need to reinforce those infection control measures. But I think all of us around the province who work in healthcare need to remember that this virus is out there, and we cannot let down our guard, and we need to pay attention to all of these layers of protection, this hierarchy of controls.
Binder Sudgeon, CTV.
Hi, Dr. Henry. Just to clarify, you said that there were 5 cases of the UK variant. The BC CDC in its situation report said 6. And just wondering if you can clarify that, and also let us know, are you looking, is there a plan to step up the whole genome sequencing, or is there something that you're looking for the federal government to do here as well?
I'd hate to be, I thought I said I had 5, but if it's 6, then I might be behind one. It could have been that there was an additional case on the weekend that's not in my list, but we can check on that. All of the UK variant ones were related to travel or contact with somebody who had traveled. And yes, we are stepping up. We've been doing quite a lot. We've been doing more than many other jurisdictions because we have a lab that has a lot of expertise in this area, and we've been doing, I think the whole genome sequencing is something that has helped us from the very beginning, and Dr. Linda Huang and Natalie Pristojecki and Mel Krajden at our BC CDC lab and their team have been doing a lot of work on this. And yes, we're coming up with a strategy to look at where we can target it to better understand if we're seeing changes in variants that are circulating in our community. So they're looking at a whole number of different areas. And yes, we are also partnering with the National Microbiology Lab on making sure that we can connect, particularly around if we're seeing transmission in people who've been immunized. That's a specific area that we want to look at more closely. closely to see if variants might be involved in large outbreaks in hospitals, in long-term care, in schools. So there is a strategy that we're trying to up our game on, and also partner with both the National Micro Lab and labs across the country. But it is something that I am very proud of what we've been doing in BC, and we've been leading the way in the whole genome sequencing strategy here in British Columbia. So we will continue to do that.
Binder, do you have a follow-up?
Yes, thank you. So we've heard from the general public and business owners about, concerns with communication and clarity of public health orders. This report from Ernst & Young highlights communication issues contributing to a lack of clarity, confusion, and inconsistency. So what are you going to do to fix that?
Yeah, well, we've already been starting on that. I think we have to remember that the healthcare system, and we're talking about in this report, is complex. And long-term care has many different ways that it is delivered. We have private, we have public, we have health authority owned and operated, we have contracted, for-profit, not-for-profit. The whole history of how long-term care homes developed is complex. And when we put in, for example, the single site order, it was not universally accepted. And it took a lot of time and effort to understand the 95 different contracts that were involved with the thousands of people that were involved in multiple different facilities. So, it was confusing for people. It was challenging when some health authorities were farther ahead than others in doing this. And we know in the Lower Mainland, for example, where people often worked in facilities in either Fraser Health or Vancouver Coastal Health, we had a lot of challenges in helping owners and operators of facilities to understand who their staff were as well. There was a lot of complexity to it, and if you remember back last March, April, when we were going through this, it took us several months to even sort part of it out. So yes, it was confusing. It's still confusing. Things have been interpreted differently in different health authorities, and those messages go out to long-term care homes, to communities. How outbreaks are managed were slightly different in every health authority as well. We are trying very hard to come out with consistent provincial approaches. I meet with my colleagues very regularly to try and do that, but there are different ways of doing things in each health authority, and we are coming out with a higher level guidance from the province to try and address that. And we see that in the provincial visitation policy, the essential visitor policy, where we're trying to get consistency. But we have over 530 long-term care homes, and they are all operated by different entities, and it takes time for everybody to come along to a single way of thinking. And it has been a challenge. I don't know if you want to address that too.
I think that just to take two of the things that happened, the single site order, which affected directly the employment of 8,500 different healthcare workers, and in terms of remuneration, tens of thousands more. That's an indication of the challenge that was faced at the time of this pandemic, which is unprecedented in our lifetimes. And yes, there were challenges in that, but I think also people did exceptional things. I think the application of that order and the direction provided by Dr. Henry and provincial health officers and the supports by the healthcare system to that order were challenging and difficult here, and there were challenges in implementation here. It's beyond question that that's the case. They're also better here than other places because of the effort applied to them. Equally, with respect to PPE and its availability and supply chain, that happened sooner here. We took the approach, it was a Team BC approach involving everybody to try and achieve success in these quite complex initiatives that were taking place in the time of pandemic. And I think that the overall results in British Columbia compared to some other places, Ontario and Quebec, Manitoba and other places, which were dealing with similar conditions in the community. Were good compared to them, but there are always challenges. I would say this, though, finally, that I think it's really to the credit of Dr. Henry, to our medical health officers and our team at the Ministry of Health and the health authorities, and all of the people working, including in the contracted sector and others, in terms of health orders in general, that I think we've made fewer changes than most other jurisdictions. We've stuck with orders consistently over time, including the present orders related to events and events both in the home, meaning only with your household, and events outside. There have been fewer changes elsewhere. Sometimes the orders have not been as severe as other places, but I think they've been followed more carefully because they've been delivered and held over time. And so what is unique and what is clear everywhere is that we have varied human activity everywhere. But the orders, I think, have been consistent. They haven't moved very much over time. And the current orders, for example, have stayed consistent since they were first put in place by Dr. Henry. And I think that consistency, along with the real contribution of people everywhere in BC, has made a difference here. Can we do better? Always, we can do better. But I think the consistency with Dr. Henry has viewed this, and her understanding that every decision has consequences for other things, has greatly assisted us in this.
Next question is from Richard Zisman, Global News.
Dr. Henry, you've mentioned a number of times today the variant. I'm not sure if you've seen this report out of SFU, which shows a picture that if the variant gets hold in British Columbia, the UK variant, we could see a mass increase in the number of cases. Can you try to explain to us the amount of concern you have around the UK variant here in BC? And the experts characterize this as a race between the vaccine and the variant. Do you see it that way?
Yeah, well, it's a race between the virus and the vaccine, and the variant is only one of the factors. The virus can cause enough havoc itself without having these mutations that make it more transmissible, apparently more transmissible. And, concern that we've just heard from the UK over the weekend that it may also lead to more severe illness in some people. That's a challenge that we've yet to actually fully understand. It's hard to know whether it's because so many more people have been infected that we're seeing more people end up in hospital and more people having more severe illness. So yes, I'm very concerned. I'm concerned that we can that if those variants start to spread, it's just going to make our job that much more difficult. And we have, if I could manufacture, if I could somehow magically get vaccine, we would be getting it out to everybody as quickly as we possibly could. But we don't have that ability right now. This is why today, I've said again, I am calling on people in British Columbia. We need to understand that we're in a very risky time. 500 people a day being affected is too high. It's at a point where it takes very little for it to skyrocket. But it also takes very little additional effort for all of us to bend that back down to where we were in the summer last year even. We need to do that. We need to pay attention. The things that stop these variants are the things that stop the virus that we know that work. And that means stopping travel, not moving about, because we take our risk with us and we bring the risk back from where we've been. We have called on people not to come to British Columbia right now, to interprovincial travel, international travel. That is something we should not be doing now. And we need to recognize for the next few months, travel is risky. That is how these new rapidly spreading variants can come into BC and can spread. So those are the things we need to pay attention to. Those who were talking to me this morning would know that this is something that I am very, very concerned about. We do not have enough vaccine to protect everybody who needs our protection right now. And we're not going to get that until a few weeks on from now, even to start. So we have to pay attention to these. The sooner we get our numbers down, the sooner we can get back to those things that we want in our lives, getting our economy going, getting our social interactions back together. But now is a dangerous time.
Richard, do you have a follow-up?
We've spent some time today talking about communication and long-term care, and one of the areas where it seems to have fallen in some sense to the wayside is around essential visitors. There seems to be an inconsistent application of that policy. Would you consider mandating long-term care homes in BC to give every resident an essential visitor?
So it is essentially a mandate that the guidelines need to be followed. And my assumption is, and I've made this clear, that everybody is entitled to have an essential visitor. We know that not everybody needs one. We know that not everybody has somebody who can play that role for them. But we need to err on the side of having somebody for every person. But we also know that it's risky. And, as I said, there's over 500 different care homes that have different leadership, that have different ways of doing things. So coming to consistency is a challenge. And we are working on that by having very consistent guidelines and putting out those messages to people that this needs to be followed. And also there is a process. And I want people to know that there is a process that they can go through if they feel that they're being unfairly denied an essential visitor status. That involves going to the administrator in the facility. It involves going to the patient care quality office in the health authority where the facility is. It involves going to my office if need be. There's an escalation process, and people can also go to the office of the ombudsperson with their concerns. But we need to make sure that people have a process for being able to get an understanding of the essential visitor status. But it is something that is so hard for people. There's a lot of concern on both sides. Staff are concerned that the more people that come into the facility, the greater the risk. And we know that it's a hard balance to have quality of life for people in long-term care. And that's why our focus right now is on protecting people in care homes as best we can and making sure that those visits can happen.
We have time for one more question. For everyone listening today, Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For updated province-wide restrictions, visit gov.bc.ca/COVID restrictions. And for information about the province's new orders and pandemic supports, visit gov.bc.ca/COVID-19. Last question today is from Zara Premji, CBC.
Hi there. So, Dr. Henry, what is your reaction to the BC couple who went to the Yukon and lied to get vaccinated? And since they are from BC, we're also wondering what that means for them getting their second dose. So what is the policy for the second dose for anyone who goes out of BC to get a first dose?
Well, I think they should be ashamed of themselves. They put a community at risk for their own benefit, and that to me is appalling. In terms of people who are immunized somewhere else and are in BC, if they're residents of BC, then the second dose may be here in the same way that if we have people who are in British Columbia for their first dose and live in the Yukon or Alberta and get their second dose there. So that is something, the immunization is free for Canadians across, for everybody in Canada, not just Canadians across the country. So one of our tenets of being in Canada is that we can interchange these. But I think I am very I'm very saddened and disappointed that people would do that. But I'm also heartened to know that the vast majority of people in Canada and in BC do not think that way and know that the approach that we have to protect those who are most vulnerable is one that they support, and I thank everybody in BC for that.
Follow up, Zara?
Yes, Dr. Henry, you mentioned if the curve isn't bent back down in BC, further restrictions could be necessary. So please tell us about what those restrictions could look like. And of course, can we get an answer in French as well?
Yeah. So, we have tried very much to only restrict those areas and those places where we know transmission risk is greatest. So we have, for example, restaurants open for restaurant dining, but we have very strict restrictions on restaurants, bars, and pubs. Around how many people, barriers, mask wearing, hours of operation, and the Restaurant Association will tell you that these are very stringent restrictions because we know that those are required to prevent transmission. But we also know the important role that things like restaurants play in supporting people getting food in our communities and the part of the community. Same with retails. We have very strict restrictions. The things that we have in place under the requirement to have a COVID safety plan have mostly worked. Where things have not worked, where we've seen people bend the rules and that leads to transmission, has meant that we've had to take additional steps. We saw that with nightclubs. We saw that with some sports venues where it was the before and after where people were coming together and socializing and spreading the virus. So we needed to take restrictions in those areas. If we find that people are trying to bend the rules to suit their own needs right now, that is going to mean that transmission will continue in our communities, and we'll have to look at additional ways to prevent that. So I can't tell you exactly what right now, but we need to all pay attention to the fact that we are in the second incubation period from a time where people took license to travel, took license to be with others, and we've seen that has led to transmission. We had a blip and we've now leveled off, but we're still at a very high level, and it is those same things. It's those traveling, it is having social interactions that aren't protected. We can still go out and do things, go outside and do things online, reach out to people, support each other. But now, more than ever, we need to pay attention to those environments where we're in close contact with crowds, when we're talking loudly, when we're not wearing masks, when we're not keeping our distance, when we're inside in particular. Those are the risky environments that we all know and we need now to pay attention to more than ever so we can get through this period.
Oui, juste pour dire que 1344 nouveaux cas pendant ce week-end est moins que pendant d'autres week-ends, mais c'est quand même trop. Et il faut l'action maintenant par tout le monde pour réduire la transmission de COVID-19 en Colombie-Britannique. Et la seule façon, c'est de suivre les conseils et les règles de la santé publique actuellement. C'est plus important que jamais. Sur le cas des gens qui ont voyagé au Yukon, mon collègue Mike Farnworth, on a parlé, je pense, cet après-midi, mais ces actions étaient dégoûtantes, voire pire que dégoûtantes. Pour moi, de toute façon, parce que les ordres actuels contre les réunions, etc., et qui met des règlements dans qui peut aller dans un domicile. Ces règlements sont en place jusqu'au 5 février, mais il faut continuer quand même jusqu'au 5 février et peut-être après de faire ce travail actuellement. C'est absolument important. Ce moment de vaccin qui est là, mais n'est pas partout, c'est le moment de redoubler nos actions et je pense que ce moment, ce janvier, ce février qui vient bientôt vont être des mois très importants pendant la pandémie et il faut que tout le monde prenne l'action à 100% pour réduire la transmission de COVID-19. Thank you very much. Merci beaucoup.